Whether or not healthcare should be publicly or privately owned is a hotly contested topic. But by applying some economic principles of ownership, we can reach a conclusion about what the ownership structure should look like. This video will make more sense if you've watched the previous video in this series explaining the different economic principles of ownership. When we think about healthcare, it's definitely needed for physical survival, unquestionably. It's needed to maintain our physical health, and it's used by everyone. At some point in everyone's life, you will use the healthcare system. Healthcare is not a complete natural monopoly, but of course it's possible to have a local monopoly. For example, many rural regions cannot support 2 hospitals, and building hospitals is expensive. So a small town will probably only have 1 hospital, and that's a local natural monopoly. Healthcare also can have significantly high barriers to entry. Building a hospital is not cheap. Maintaining a hospital is not cheap. Certain medical treatments have no substitutes, and the production of some specialized medical equipment or patented pharmaceuticals can be monopolized. Certain treatments, if they're patented, are kind of like a monopoly, and certain pharmaceuticals, again, if they're patented, are a sort of monopoly. Having private enterprises control the healthcare sector results in much more expensive and less efficient healthcare. This is because profits paid to shareholders are not available to improve and maintain the healthcare infrastructure. And having multiple parallel bureaucracies serving multiple parallel agencies introduces a lot of additional expenses. Every private healthcare provider must have its own team of lawyers, its own team of accountants, its own marketing team, and so forth. These are extra costs that are paid for by the customers of the healthcare system. When you have a publicly owned healthcare system, it doesn't need to have any marketing. The public system can share the lawyers and the accountants across the entire system, lowering the overall marginal cost. Another problem with the healthcare system is that by having competition in it, this will eventually, if not regulated, produce monopolies or near monopolies that then will result in very high prices, which are, of course, to maximize shareholder value at the expense of patient health. Having private enterprises in the healthcare system also introduces inequity because it enables wealthy people to get superior and priority treatment, while the poor often cannot afford care that they need. The maximization of economic profit reduces the focus of private firms on the provision of non-economic benefits to society, such as keeping people healthy by pursuing preventative medicine rather than just waiting for them to get sick and then profiting from curing the symptoms of their illnesses while disregarding the actual causes. In a private system, the incentive is to have a lot of sick people that are chronically ill because profits will go up. Whereas in a public system paid for by taxpayers, the incentive is to make everybody healthy so the overall burden on the publicly owned system is lower. Forcing the healthcare sector to be publicly funded and removing the possibility of private enterprises operating within the healthcare sector gradually motivates society to address root causes of diseases such as homelessness and poverty. These are often the causes of illnesses that private healthcare is not going to address. Having private healthcare forces publicly owned healthcare to talk to the government to find solutions beyond strictly the healthcare sector. And this can provide very substantial non-economic benefits to society, like having people that live longer lives and can contribute to society in innumerable other ways. Private healthcare produces worse outcomes for public health at a greater cost. So there is a very convincing argument in favor of having the entire healthcare system be publicly owned. I would even argue, and some will disagree with me on this, that even elective operations or cosmetic surgery should be handled by the public system. But I will grant people who choose to have those services should pay full cost for them. The reason for this is by allowing some private enterprises to operate within the public healthcare system, this is kind of a slippery slope towards where those private enterprises will gradually grow and capture more and more of the healthcare system, which will then end up with a 2-tier system, which will be a subpar option compared to having a fully universal, publicly owned healthcare system. So I think that the healthcare system should be completely publicly owned.